Good morning, everyone, and thanks for coming to the Ask TLC Zoom show. We are pleased today to have with us Melinda Billig, who's a licensed clinical social worker and a volunteer for TLC. She does many wonderful things for TLC, including one-on-one counseling, group facilitation, and presentations. Melinda, I'm turning it over to you.
Hi, everybody. Thank you for being here. I'm just going to start by telling you a little bit about myself and how I got started in working with people who've lost people to suicide. I worked for many, many years, 32 exactly, for the Department of Education in New York City, and I ran a lot of crises teams there as supervisor of social workers. And I worked a lot with trauma. And when I came to the villages, I have a friend who lost his son to suicide. And I thought to myself, what worse trauma is there than losing a child to suicide? Losing a child in general is traumatic, but losing a child to suicide, to me, is one of the most traumatic things anyone could experience. But then I thought about it, and losing anybody to suicide, losing a spouse, losing a friend, losing a relative, losing anyone, even a colleague, it's just such a trauma because of what the person leaves behind. And the guilt and the shame of everybody who's around them thinking, what could I have done to prevent this? Why didn't I see this coming? And what could I have done to prevent this? So I decided I was going to run a group in the villages for parents who've lost children to suicide. And I started doing some research, and a lot of trauma theory is very similar to suicide theory. But I've taken workshops and done research. And so that is why today we're going to talk a little bit about suicide and ways of preventing it, if there are such things, because it's really very limited. And no matter with all the interventions that we can do, there's still only a 50% success rate in the ability to be able to prevent suicide. So Bonnie, let's go with the first slide, please. Okay, this is the scope of the problem. As you can see, suicide is the number 2 leading cause of death for ages 10 to 34. There are in 2023, there were 49,000 plus deaths by suicide. You can see that it affects adolescents, 12.3% of adolescents, and 14.7 out of 100,000 people. This is in 2024, which increased 37% from the year 2000. But of course, that was also right after COVID. Okay, let's go on. Next slide. Now, I think this is a very important one, especially for us. And this is why I thought it was really important to talk to our age group about it. If you look at the chart, people over age 85 are the most likely of all populations to commit suicide. Ages 75 to 84 follows that, with middle age 35 to 54, and then 55 to 64. And then, of course, ages 25 to 34, 15 to 24. Elderly populations are the most at risk for committing suicide. And it's the leading cause of death. But there is lots of reasons, and we're going to go into it later, talking about loss and the different kinds of loss that people experience, and especially people at, in their senior years, because there's so much that we lose, and our friends and family loses everything from physical ability, and we don't have the same vibrancy we had when we were younger, and there's all kinds of physical ailments that occur. we lose friends, we lose spouses, we lose children. Many of us, when we're not working, lose a sense of identity because so much of our identity is often wrapped up with what we do instead of who we are. And people lose income, and loss of income is another one, but we will go more in depth into loss later. But yes, we are the most at risk for suicide at the seniors that we see all around us. Okay, let's go on to the next slide, Bonnie, please. Thank you. There are many different risk factors that contribute to people choosing to commit suicide. And of course, mental illness is the most common, and depression, followed by anxiety disorders, schizophrenia, bipolar disorders, anorexia. Another one is previous hospitalizations. Unfortunately, people who get hospitalized, what they have discovered is that upon release from the hospital, about 50% people go on to commit suicide. That's not a great tracking record for mental health when you think about it, that 50% of the people from that get hospitalized for suicide ideations end up being helped by being in the hospital, but 50% get out of the hospital and continue and are able to complete suicides. Previous hospitalizations, a prior psychiatric hospitalization, recent discharges, what I just said, the highest risk period, history of suicide attempts, and self-harming behaviors, which we know of a lot of kids that engage in self-harming behaviors. History of suicide attempts. There are many people that attempt suicide many times before completing suicide. Substance use disorders, alcohol, opioids, other drugs, and co-occurring disorders, depression, and often people self-medicate by using different substances, and so many people have dual diagnosis but are substance users, and there's a high incidence of suicide amongst substance users. Additional factors, and many of these affect our senior citizens here: social isolation, trauma and adverse experiences, whether it's recent trauma or past trauma, impulsivity and thrill seeking. I think that's much more teenage and younger than seniors, but it certainly could be. Stressful life events, and that, of course, can happen to seniors. As I said, losing jobs, losing identities, losing physical abilities. There's a lot of stressful and losing friends and family is very stressful. Losing houses, losing places to stay. Chronic pain or illness, that certainly is a big factor for seniors. There are many people living with chronic pain that just cannot handle it anymore and say, I want out. And of course, what suicide is the human beings want to escape pain. It has less to do with wanting to hurt others, but to just get away from the pain, whether it's psychic pain, whether it's physical pain. People who choose suicide choose it to alleviate and stop the pain. Okay, let's go on to the next slide. Now, there are suicide risk assessment tools, and I'm not going to go into specifics because you guys really don't need to know about it, but they have varied risks of success in identifying people who are the most at risk for suicide and in their predictability. And unfortunately, their rate of success like I said, in the hospitals is also pretty low in terms of their prediction ability. It says moderate to good, but very often the all the scales that they give are, tend not to be 100% accurate in their predictability about who is at risk in committing suicide. I shouldn't even say the word committing because that's a no-no, that's a faux pas in choosing suicide. Now, these questions are really the important questions that every therapist asks, and a lot of lay people ask friends or family. And these are the most important questions. In the past few weeks, have you wished you were dead? In the past few weeks, have you felt that you or a family member would be better off if you were dead? In the past few weeks, have you been having thoughts about killing yourself? Have you ever tried to kill yourself? And then most therapists say, do you have a plan? Have you thought specifically of a plan how to kill yourself? And it says here, a yes response to any question. Positive screening means further assessment and safety planning. 97% of youth at risk for suicide identified with a positive screening. Okay, let's move on. All right, these are also rating scales, and we really don't have to go specifically into them. Let's go on to the next one. Intent, plan, behavior. I talked about that. The people most at risk are the ones who say that they have a specific plan, that they've been thinking specifically about, jumping on a train track, taking an overdose of narcotics, various things. They have a gun, they have a knife, or more often with youth, displaying, very laissez-faire behavior, where very risky behaviors, riding in the car very fast, drinking and driving, and with an attitude of like, what's the difference if I die anyway? Okay, let's go on to the next one. Now, this is the one that I think is certainly the most crucial, especially for people, for seniors that we live with, and for ourselves. Relationship losses is a great big one. Death of a loved one, divorce or breakup, loss of friendship, family estrangement, and social isolation. These things really very specifically affect everyone, but they certainly can affect people over 65 because, I think we're the ones who lose the most people in our lives, the most friends, the most family. And I notice as I get older, year after year, I'm losing more and more friends and more family, and it's very, very painful. Let's see, physical losses. That for sure affects seniors more than it affects younger people. Chronic illness diagnosis, physical disability or injury, chronic pain conditions, loss of independence, and that's a great big one, and terminal illness. And people living with spouses who have terminal illnesses, loss of independence. I remember taking my mother's car keys away and how devastated she was that I took her car keys, I took her independence. We're so used to doing things on our own, and when we have to be cared for and we feel like we're nothing, but nothing but a problem to everybody surrounding us. And I think that's really a tremendous one, feeling like you don't want to be a burden to your loved ones and wanting out. Environmental losses, loss of housing or homelessness, loss of community or a sense of belonging, which happens frequently with seniors who lose their jobs, which for many people is their identity. A lot of males, and now more and more as women are in the workforce, a lot of females, people who have a sense of belonging to a community every morning when they get up and go to work, and then that stops. And unless they make a conscious effort to have a sense of belonging, whether it's in a community center or some place where they go for lunch or a group of friends that they meet on a regular basis, it can be really devastating. Forced relocation, cultural disconnection, loss of safety or security, and of course, many seniors experience those things. Professional and financial losses, as I said earlier, job loss, unemployment. For younger people, unemployment, I think that's a tremendous depression factor for many people. When they lose their jobs, they lose their identity, they lose financial ability, financial crisis, bankruptcy, loss of career and professional identity, which I said earlier, retirement challenges and business failure. Retirement challenges, I mean, I think here in the villages, we are extremely fortunate because when we do lose our sense of identity with work, there are so many other options here for us that as long as we find passion in a sense of community, whether it's belonging to a club here, and we all know there's a zillion clubs to belong to, whether it's something physical that we engage in or emotional. There's churches and synagogues all around us and mosques. It's a sense of identity and like they said in Cheers, where everybody knows your name and you're always glad you came. Well, I think that's very, very important for us to have at every stage of our life. Identity, status, and losses. Loss of reputation or status, again, that can have a lot to do with work and work-related, or leaving an area. For many of us who came to the villages from other places where we were very involved in our communities, very involved in our churches or synagogues or mosques, very involved in our neighborhoods with our neighbors and friends. Those changes can be terrible losses to our identity. Public humiliation or shame, loss of role, parents and caregivers, identity crises, and we certainly know how many people go through empty nest syndrome when their children leave and they're no longer needed as parents. Look at how many of our neighbors, and maybe some of you, identify as a grandparent. And so much of our role of who we are is being a grandparent, being a parent. And I know people who live next door to their children and their whole lives are wrapped up in being a grandparent. I think maybe less so living in the villages because we have so much of our own lives to do and get involved in. But for a lot of my friends back home, they are very involved with grandchildren. Psychological and spiritual losses, loss of hope or meaning. I think that when you have a lot of losses, a lot of deaths, and a lot of losses, that can certainly affect your faith and a feeling of hopelessness, your loss of spirituality, loss of purpose, as I said earlier, cognitive decline. And even if we do not have Alzheimer's and we do not have dementia, many of us can't remember names, can't remember places, can't remember people, can't remember things of the past because we are in a period of our lives of cognitive decline and loss of control or autonomy. And that we all know is very difficult for anyone. Having to give up their autonomy and their independence is a very, very tough one for anybody. And that happens with seniors. It often happens. Okay, let's go on to the next slide, please, Bonnie. Social connection. And this is where it is so vital as a senior to remain connected, peer support groups. And that's where TLC comes in because we offer a lot of support groups for many things. though we can walk into any rec center here in the villages and pull out one of the newspapers and open it up and see there are so many different groups that we can become members of, and our friends and our neighbors can become friends of. We can engage in community activities. Often every community has parties for every holiday that we can sign up for and see our neighbors. When we first moved in, there were the garage parties, those great big, what are they called? Anyway, people have a lot of parties in their neighborhood when they first move in, and then that kind of dissipates. Family therapy and reconciliation, online support communities, and volunteer opportunities, which there are many of here in the villages that we're fortunate enough to have lots of volunteer opportunities, whether it's in the schools, whether it's in the hospitals, whether it's just volunteering to work in your church or your synagogue or work with people in, various groups. There's so many different groups that we have an opportunity to work with. Meaning and purpose. I think that vitality comes with meaning and purpose and trying to find your passion. And it says values clarification exercises, goal setting, future planning, spiritual or religious support, creative expression and activities, mentorship opportunities. Fortunate for us, we in the villages have the opportunity to do many of those things, to go through those catalogs, to find something that there's an inkling of interest in, and then experience it and see if you can become passionate about something, passionate enough about something in your life to engage in it on a regular basis and give more meaning to your life. Professional support. Here in TLC, we offer individual therapy. We offer grief counseling. Career counseling services, not so much, because at this stage of our lives, most of us have done that, have been there, and are retired and looking for things to do in retirement. Financial planning assistance, I know that is offered. Case management services. There are various hospitals and social services organizations around us that we can help connect you to. Practical resources, housing assistance program, again, employment services, but at our stage, I don't think there are very many people that need that, but certainly our children and our friends' children. Healthcare access support, legal aid services, financial assistance programs. There are practical resources that we can probably help secure for you. Or you can help your friends secure it when needed. I know that, what's Lisa's organization? Not a place for mom, but
Your Key to Senior Living
okay,
Options.
options, that's right. There's Your Key to Senior Living Options, which we think is a great resource. And we certainly give that to many, many people. Okay, let's move on to the next slide. Now, these are different therapies that work. We're going to pass this slide because we're not here for therapy, but certainly if you see somebody in pain and you refer them to therapy, we will see to it that they get the therapy that they need. Next one. Okay, this is where I want it to be. Taking action, what you can do. Now, of course, here it's for healthcare providers, implementing screenings. And, I was at the doctor yesterday. And what was so wonderful is right away after they did my weight, they said, do you have somebody in your life who cares about you? Do you have activities that you care to engage in? They asked all the right questions. And I told them that as a mental health practitioner, it warmed my heart to see medical practitioners ask these questions, because for so long, these things were not asked. These questions were not asked. And I was delighted that they asked me and that they ask everyone these questions, because the medical profession is finally seeing mental health as an important thing in terms of safety and health, that it's just as important to be mentally healthy as it is to be physically healthy. Let's go on to family and friends, because that's where we come in. Learn the warning signs of suicide. Ask directly about suicidal thoughts. Listen without judgment. Help secure lethal means. If there's a gun sitting on the table, you must, or if you see that there are a gazillion sleeping pills in the medicine cabinet, you need to try and secure these things. Stay connected and follow up. It is so essentially important when you see friends withdrawing, when you see, and the behaviors, we're going to go down to the bottom in just 1 minute. Well, actually, we can do that now. If you see friends, and we're going to look at the warning signs of suicide risk, which is the most important thing. If friends start talking about wanting to die, feeling hopeless, or being a burden to everyone around them, that is a great big red flag that they need help. If they increase substance abuse, and let me tell you, there are many people here in the villages who not only drink a lot of alcohol and abuse alcohol, but also marijuana and other substances behind closed doors. And so that's another telltale sign. Withdrawing from activities and giving away possessions. If your friends, if your family start saying, no, I don't want to, if this was an active person who all of a sudden doesn't want to go anywhere, doesn't want to do anything, doesn't want to get out of bed, that's a big sign. Stops taking care of themselves in terms of showering, stops eating. These are all red flag behaviors. If you see them, people who are depressed, who are anxious, who lose interest, or who go into extreme rage for no reason whatsoever, or something that is so minute that this is so out of character for that person. Extreme mood swings, when somebody is either very, very high and running and going and doing and in a manic stage, or when their affect changes and they have very low affect and everything seems like a chore or a burden to talk, to act, to go places, to do things. Those are big telltale signs of depression, and that person needs help. If you see this, it's really imperative that you talk to this friend about getting help, or try your hardest to engage this person with a therapist, with TLC. And of course, there's the 988 Crisis and Suicide Lifeline, which is important for you guys to know about. That is available 24 hours for you to get help with both online people who are trained to deal with at-risk behavior, as well as referral services to local to mental health facilities in your neighborhood. So again, 988, that's the Crises and Suicide Lifeline. It is really up to us. The thing I want you to all understand is, even with at-risk behaviors, and even with diagnosis, and even with getting help, nothing is foolproof. Yes, there are ways of combating people who are at risk for suicide in terms of getting them back engaged in life, back engaged in passion, back engaged in the community, for them to know that there are people out there that care about them, that love about them, that yes, their life makes a difference and their period on earth makes a difference. And still, with all that, remember, there's 50% success rate. There's only 50% success rate. I tell you this because so many of us who know people, myself included, I had friends who've taken their own lives, feel, what could I have done differently? How could I have changed this? And often, if a person is intent on doing this to escape their pain, no matter what we do, no matter how much we engage in trying to help, whether you're their therapist, their friend, their spouse, their mother, we can't always do it. We can't always get to them. We can't always get to them. And we've got to understand that it wasn't us, it was their escape from the amount of severe pain that they were in. And that no matter what interventions we've tried or we haven't tried, we might not have been able to save them anyway. And on that, I will end.